So I'd like to introduce you to a model. It's called the ouch model that helps us confront implicit bias and microaggressions. So it's about educating, disarming the offending microaggressor. We need, so here are some examples that of just microaggressions that might seem innocuous. Like, oh, we need someone older, someone more mature and reliable. For a younger person, that's a big ouch. Why do they speak their language when I'm around? It makes me uncomfortable. Invalidating the fact that we live in a multicultural society with lots of languages here in New York. He's from one of those African, Caribbean, South American countries. You fill in the blank. It doesn't matter which one. They are all the same. Ouch. She doesn't look like a lesbian. He doesn't look gay. Ouch. They don't look black. She doesn't look Hispanic. Ouch. Religious people are so narrow-minded. Ouch. She has no accent from whatever. Ouch. So the antidote for implicit bias and microaggression is giving feedback. Remember I said that, uncovering your implicit bias, the only way that we can figure it out is if someone gives us some feedback. So it's really important not to dismiss feedback. If you're lucky enough that someone has the courage to give you feedback, you need to listen and not be defensive, and you need to listen to that feedback. And this, of course, is solicited and unsolicited. But if one way to absolutely move forward in your journey of cultural humility is to try to solicit feedback. So when you solicit feedback, there are 6 steps to move forward. First, you want to breathe. You don't want to become defensive and angry. You want to be grateful for the feedback. This helps people to, in the future, be more willing to give feedback. You want to listen. You don't want to talk. You want to let them finish what they've said. Then you want to reflect. You want to think about what you've heard, what this person, this very brave and great, person has shared with you. Sometimes it requires an apology, especially if you have been given feedback around something that you said or did, and it had, remember, it's not about the intent, but the impact. If it had a negative impact on someone's feelings, etc., you need to promptly apologize. And please, please do not include in that apology, it wasn't my intent. Don't say it wasn't my intent. Just apologize. I am sorry that I said that. I was not aware that that was hurtful or disrespectful, and I apologize. And hopefully, at the end, you're going to learn and move on and hone your cultural humility. When we respond to unconscious, when we respond to this feedback, or this feedback, always first, assume good intent. All right? And this is really, really important because when we get feedback, sometimes we can be very, very defensive. So we need to breathe and we need to listen. And always assume that it was good intent, that people are trying to help you. After you get the feedback, please ask questions. Ask maybe, how could I have done it differently? What could I say instead? Make it an individual issue instead of trying to generalize to everyone or to every sort of circumstance that might include that particular action. Broaden to universal human behavior. Understand that what is happening in terms of these cognitive shortcuts are universal and that we all make these mistakes and that we can learn from these mistakes and grow. Sometimes we need to interrupt and redirect with some conscious or unconscious feedback that might not have good intent. And so it's really, really important in that moment to set your boundaries and to redirect in terms of what is appropriate and what is not appropriate. And then finally, you need to say ouch. You need to let people know. And this is around, self-awareness of what it's feeling to you and getting this feedback, as well as regulating your emotions in terms of not being dismissive, listening, but also in terms of the agency and telling people that is offensive, that is hurtful, and I would really appreciate it if you never said that again. So, in conclusion, I want to just really quickly go through some strategies to help you hone your cultural competence. So strategy number 1, acknowledge that cultural differences exist and may present challenges or difficulties in clinical, academic, and research settings. We need to acknowledge that we all have culture too. Stop thinking of like going into that clinic, into that exam room, and that the patient is the only person who has culture in the room. You're bringing culture too. You have your cultural lens, and it is also impacting the interactions happening. Own your competence. Now, this could be at various different levels. You could be moving through the stages of learning, but what is really important is to recognize where you are in the learning process. Try not to, be defensive, manage your tendencies to judge and assume behavior in conscientiously or incompetent ways. And always be mindful of the fact that you and others might have blind spots, and that this is a learning process, and that we need to approach it with thoughtfulness and mindfulness as we try to learn about our blind spots and try to help others learn about their blind spots. We need to recognize that we have a particular worldview, okay? I have here my view of Philadelphia, but I also have other worldviews. I live in Brooklyn, and I was born in Texas. But we need to also assess the impact of our worldview and how our worldview, whether, with other components like time orientation, use of space, notions of power, communication, etc., have an impact on care and treatment. And this is something, as an anthropologist, I want everyone to know. Ethnocentrism is assuming that others operate with the same social and cultural rules that you have. And that is a barrier, okay? When you only see the world run by through what you consider are the rules or modes of engagement, you are being ethnocentric. And you need to consider other people's perspectives. Now, suggestion number 3 here is about meeting people where they are, not where you are or where you want them to be. So here what we're talking about is we're not talking about the golden rule. Don't assume that others would like to be treated the way that you would like to be treated. What we're really talking about is the platinum rule, basically treating others the way that they want to be treated. Suggestion number 4 is about communication. Learn how to ask culturally sensitive questions. Remember the video with the woman asking about, so tell me the rules in terms of the Hmong community, and tell me the rules and what I need to understand about why you need to have a shaman. We need to listen. We need to observe. We need to mirror. We need to flex. We need to solicit feedback to identify and address our blind spots. And we need to, in moments, provide culturally sensitive feedback when appropriate. Number 5, we need to increase our ability to empathize. And this means basically envisioning ourselves in someone else's shoe and trying to also understand that I would not want to be treated that way. This is how, if I were in those shoes, this is what I would be feeling. And to meet them there with, I understand that this is scary and that I'm here to help. And just showing a little bit of empathy goes a long way, especially with older adults. So I love this. Empathy, this very funny cartoon, this doctor here who's also wearing a jacket exposing his tush. I think you'll find I'm one of the most empathetic doctors around. Empathy here is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. Suggestion number 6, I want you to use your emotional intelligence to stretch your comfort zone. In order to hone your cultural humility, you have to move away from what you used to do all the time. And this is really difficult. Some people are just really fixed in how they do things. And, in medicine, if you are nursing and whatever health profession you're pursuing, it's really, really important for you to understand that to be really effective within this multicultural context and to hone your cultural humility, that you have to step outside of the zone that you feel most comfortable in. So this is a fun little activity where I try to get you to recognize that we need to unlearn things that we think. So just quickly, and maybe get a friend to do this, I want you to try to repeat these colors, say the color, not the word, as fast as you can. So blue, yellow, red, purple, black, blue, yellow, red, purple, black, blue, yellow, red, purple, black, blue, yellow, red, purple, black. Pretty easy, right? Now, yellow, red, blue, green, purple, yellow, red, blue, green, purple. It's a lot different when you have to move outside of that comfort zone and to do something that is different than what you've done before. This is just a little illustration of ultimately mad advice from Yoda here, that we must unlearn what we have learned. And don't practice until you get it right. Practice until you can't get it wrong. That's ultimately developing cultural humility. Again, it is a pleasure providing you with this lecture. My name, again, is Tonya Taylor. This is my email, and thank you. Thank you very much.